A very good morning and welcome to the Quality Measurement in Health Professional Education, Revisiting the Metrics, our international conference, which I'm very pleased that kicks off today with the pre-conference workshops. Assessing the quality of health professional education interventions is a task that appears more difficult than the comparable task with clinical intervention. What to measure, how best we can measure it, and so what are important questions we are struggling and trying to find answer to it. The aim of this conference is to create an opportunity for health professionals, educators, regulatory bodies, healthcare authorities, public and private healthcare services providers to interact with experts in the fields of quality and assessment, share experiences, and how to introduce new assessment methods in their own contexts. The speakers are scholars and leaders of innovations in health professional education. The conference will be an excellent opportunity to meet, discuss, and exchange opinions and best practices in the field of assessment and program evaluation. It's a great pleasure to present Professor Fadi Munshi, the Director of Postgraduate Medical Education, Saudi Commission for Health Specialties, Kingdom of Saudi Arabia. Professor Munshi is a well-known educator and particularly having great interest in the field of assessment. And in his workshop today, he will share with you how Exam Bank's Health Index, very interesting concept, know the physiology of items to recognize the pathology. That's really an amazing way of presenting exam banks as a patient who is suffering or he may suffer from some symptoms which are reflection of diseases. I am sure all of you will enjoy this workshop and interact with Dr. Fadi Munshi. Thank you very much, Professor Munshi, for accepting our invitation. And I look forward to meet in person very soon, inshallah. Thank you.
Well, thank you very much for the invitation, and it's really an honor to be part of this unique conference, which was initially scheduled in person and has been changed due to the circumstances the whole world is dealing with. Very, very unique concept. Elite speakers, pioneers in the field from all over the world. Great opportunity to learn from different people. And I thank you very much for taking time to attend. It really shows that you care about assessments and quality of education. So today, this workshop is actually an in-person workshop. I had a little bit of difficulty changing it to be virtual. So we tweaked a little bit of the exercises to be delivered through breakout rooms. I see some common friends. I see Professor Zayat attending. He's one of my teachers. So I think his contribution will be very valuable, and you're lucky if you have him in a breakout room with you. So basically today, I'd like to introduce myself. Like Professor Hamdi mentioned, I'm MD background, then I have a PhD in medical education with the focus on assessment. Currently, my role is Executive Director of Assessment. I oversee all the assessment functions at the Saudi Commission for Health Specialties, which are related to postgraduate education, residencies, fellowships, and professional practice, licensure exams. So we have a mix of both the regulatory and the training component, academic training component. So the bread and butter of my everyday work is assessment. I'll come to the story now. So what we do right now, currently we do two things. We develop questions, we do written exams, and we do performance exams. So we've recently moved and delivered the exams. So we have the biggest computerized testing center in the world. We've just across 8,000 square meters, and we just moved into it around a year ago. And these are some of the pictures that we aim for a test taker to come and go through an experience that they will enjoy, regardless of they pass or fail, but they enjoy the experience and try to, as much as possible, relieve the stress related to exams. So just to start and set the expectations, when we talk about bank health, we do not mean the bank with money. We're talking about question banks, item banks. So over here, when we talk about items, we could refer to them as multiple choice questions, or if you have other types of questions, but mostly here, items are related to MCQ multiple choice questions. And banks, it's not the one with the money. So it has to be very clear. If you're looking for bank health, I think you need to go to a business presentation, a business school presentation, not this presentation. Here, we're going to talk about bank health. That's the question bank that has a group of questions or items. So I think that expectation is clear. Probably right now, of the 120 participants, a few will go and find the business school presentation, because I think the bank is more important, the one to the left and the one to your right. So establishing a new question bank. I'd like to start with this group. So number one, why do we need a question bank? Why do we establish a question bank, and how do we establish a question bank? So just to get us in this lovely morning, I think around the world, even here in this part of the world, the weather is really amazing. So to get us up and running, I'd like to assign breakout rooms. There will be around 6 to 10 people in each breakout room. And please, the focus of the discussion is, why do we need a question bank, and how do we establish a question bank? What are the steps to establish a question bank? We'll take 10 minutes in this exercise. And please, randomly from every group, if someone can just summarize and present to the group. We'll be having 10 groups, so please, just the question is, why do we establish question banks, and how do we establish question banks? I'll stop sharing, and each workout room will have 10 to 12 members. So we will have 10 breakout rooms. Please, in every room, assign a person who will present on behalf of the group. So out to the breakout rooms, and we'll see you in 10 minutes. Okay, welcome back, everyone. So you've been in groups, and the question was, why establish a bank, and what are the main steps to establish a bank? If we could have a few, please volunteer to present what was discussed in the group. I see Omar Farouk raising his hand. So Omar, please, if you could go ahead and just briefly share what was discussed in the group.
We have given options to them to unmute, Dr.
Okay.
Munshi.
Okay. Omar, if you'd like to go, or someone else.
I can see I'm unmuted. Can I go? I'm Nisha here.
Go ahead, Nisha. Go ahead, please.
Yeah, our group was actually very productive. We had a lot of discussion. Time wasn't enough for us. It's absolutely amazing topic, right? So now, why do we need a question bank? We came up with two senses on this. That's basically because it generates a repository of high quality categorized questions. And especially because there's a given high turnover of faculty. So what happens is some faculty teach a course and after a while they leave. But you still need to ensure the quality of the assessment in the course, right? So if a question bank, the faculty can go back, look at the question bank and see what are the must-know areas, or what are the areas which are addressing different categories. So that's kind of a guideline for the faculty who keeps changing. There was also another thought which was shared saying that some colleges or some universities outsource the question bank and use it like a source of revenue. So it's not just for in-house use, but also as a source of revenue by outsourcing. So that's what we think is why we need a question bank. Obviously, outsourcing is secondary, mainly obviously for quality control. And how we do it basically by checking on the quality of the questions, be pre-assessment quality assurance. Like when the questions are submitted, we have a vetting committee or the assessment committee who looks through the quality of the questions, the validity, construct validity, content validity, face validity, and then we see the whether it's categorized properly. Okay, so that's the pre-assessment quality assurance. Then we deliver the assessment, and after the assessment is done, we have a post-assessment quality assurance. That's the exam psychometrics, looking at the difficulty index and discriminative index. So the questions which pass through these two quality checks, that is pre-assessment quality checks and post-assessment psychometric requirement, then we move that to the question bank. So we ensure that we have a very high quality of the questions. That's basically what.
Thank you, Nietzsche. I think we're done with the workshop. We don't need this workshop anymore. So you mentioned it all. Thank you very much, Nietzsche. Anyone else would like to share?
Yes,
Yeah,
I
good
am
morning.
one from group one.
Okay. Good morning, Dr. Munshi.
Yes,
On behalf of fourth group, we have decided why we have to do the question banking. It is able to retrieve the questions using the same codes. And this is a good tool for evaluating the program assessment. And reusing the questions are based on the quality of psychometrics. And we develop data about performance and outcomes of the students and show the gaps in the teaching. And this is a very good tool for evaluating the program. And proper sampling and randomized questions can be given at each time of the exams. And it also establishes partnership between the institutions and benchmarking between the institutes also. Absolutely. And how we have to do is we have to decide what is the purpose and formative or summative, and we have to have a good IT support or in-house pool of examination questions, or we can outsource from the established softwares. And we can pull up good quality of items and training the faculty how to make the questions and making the rubrics and quality evaluation of the questions. And then most important is maintaining the confidentiality are the things which we have to follow when we are doing the question banks. These are the things we have decided, Professor.
Thank you. Thank you very much, Nancy. You know, we've changed from the in-person session to the virtual session. So I think at least if we could have whoever can have their cameras open, it would be really nice to see people. We haven't seen people with this COVID. We'd like to see lots of people. So if possible, please we'd like to see everyone. Whoever would like to go next, to Mohammed Al-Adi.
Yes, thank you, Prof, for this invitation. Actually, with question bank, before the exam, you are making all your questions available, very high standard, selected, so all the faculty can have access to the questions and pick up all the previous tested questions so that we can have a high stake exam. And also the question bank also really very useful in getting the depth of the analysis of each question, so that when we are using these questions several times, we can have data related to each question, so that we can use this analysis for the future. Regarding how to make the exam, the question banks, we as usual we are building our own questions because this is related to our own curriculum. It's very difficult to buy it or to get it outsourced from outside. But what we're doing usually, we are making committees, building some questions related to the outcomes, and they are revised by several specialists in order to get the good questions that we need and put it in the question bank.
Thank you very much. I think if we could take the last comment, Arina.
Yes. So with our group, we have discussed that the main purpose of creating a question bank is ensuring standardization, of course, and having a range of questions. And in terms of the steps of establishing creation of this bank, first of all, it's important to create a blueprint, which will include everything which is important. And first of all, it should match the content of the course or of the curriculum, and it should be aligned with the outcomes of the course. And you have to make sure that all of the items and problems are covered, that they are tagged properly, and the level of difficulty is also important. So the blueprint is the key.
Absolutely. Thank you very much. I'm sorry for everyone raised their hands, but we'll have more opportunities to participate. But thank you very much. I really love seeing more people right now with the cameras. So I'd highly encourage others to open their cameras if they can. So we'll continue. So I've heard develop question banks because benchmarking, it's the quality questions, the standardization, and also there was a mention of revenue. So someone here is looking for question banks really for revenue. So one thing that I've noticed, in different practices, working with different universities, working with different institutes, is when there's an exam, usually we look at forms. They tend to look at a form. So this exam, let's say it's 100 questions. Let's develop 100 questions. But then when the exam is delivered again, you will need to develop, use the same 100 questions, or you're going to need more questions. So at the start, you have to know the purpose of this exam, as mentioned. And then accordingly, you plan. Is this a one-time exam where you're developing this form of a certain number of set questions and that's it? Or it's something that will be repeated continuously, which you will need to start considering a question bank, not just developing one form at a time. And I see this especially at the level of colleges and universities. The way developing one form, and then next year I'll need another form. I might use some of the items that were tested or used in the previous form or the previous year. So it really depends. I heard the purpose. So starting at what's the purpose? How frequent is the exam going to go? What stakes are there? So this is where you start. Do we really need to develop a question bank, or should we just have one form because this is not a very frequent exam? So that's the first decision you have to make, because developing a question bank is not easy, but on the long term, it does pay off. And I heard the mention of validity, I heard the mention of quality, I heard the mention of standardization. So we've been, in these 6 years, probably we've been through the process. It's I've developed with the team around 10 different licensure exams, national licensure exams in different healthcare fields: medicine, dentistry, pharmacist, respiratory therapist, nursing, psychology. So we do this national licensure exam. It's a huge exam that's mandated on anyone graduating and wanting to practice, this entry-level exam. And I'm sure you all know how licensure exams are very high stakes. We've developed other question banks related to postgraduate training, residency programs, and all the different disciplines you could think of. So the start, and this is basically, I just try to put the different steps down. Number one, you need a job analysis if you're developing a licensure exam, or as mentioned from the group, the core reference is the curriculum or the competencies in the curriculum, objectives, outcomes. What this exam, if we talk about the licensure exam, it's entry level into practice. So what are the minimal competencies required for someone to practice? And this is what you're testing. There was a mention of the curriculum. So you have the competencies, you have the objectives, and most likely the curriculum was built based on a job analysis. This curriculum graduates a safe nurse. This curriculum graduates minimally competent respiratory therapist. So that's number one, is what are the core competencies of this bank that will be assessed. And then there was a mention also from establishing the blueprint and test specifications. So what we'll discover, you have to ensure sampling across the domain, across the specialty, across the discipline. And the test specifications, where you identify how many questions, what is the distribution across the different sections of the domain, what's the timing, what's the time per item. So are there breaks? Will it be segregated? Like if it's 300 questions, is it 100 and then there's a break, and then 100 there's a break? Is it continuous? So that's the test specifications you will have to identify. Number three, this question bank, would it be developed by individuals? Will it be developed by committees? Will we need to form, especially when you talk about a national exam, like a licensure exam, or if you talk about a university level exam, will you need to have different people teaching the same course within a committee develop this bank or participate in developing this bank? Or will it be individual subject matter experts whom you will have to set some criteria to certify them or provide them with the knowledge required to participate in writing this exam bank? Very, very important concept. Please start right. When you start right, you will have a question bank where you will not have to keep on opening the question bank and looking back into the old items. You'll just have to look at post-exam analysis. So starting right, who will participate in writing this question? Do we need someone who's in practice, actively practicing? Do we need someone who's at the level of a professor? What are the years of experience? So set the criteria of, do we need someone who's a technician? Do we need specialists? Do we need consultants? So what are the criteria of the subject matter experts participating in writing this and developing or establishing this question bank? And then recruiting the subject matter experts. Of course, the more people that participate from various experiences, various backgrounds, the more you could enrich. And this is an evidence of the validity of the test, having different people participating. And most important thing is SMEs are subject matter experts in their disciplines. They have some background with regards to writing questions, if you're writing multiple choice questions, SAQs, OSCEs, they have experience in their discipline. They may be the best neurosurgeon in the region, but that does not mandate that they are experts in writing multiple choice questions. So please ensure, as a form of validity and evidence of validity, that there's at least some minimal training with regards to writing questions. So just to ensure that what's coming into the bank, the questions coming in, you've trained all the SMEs and you've certified them in a certain way. Number two, you'll need to set the target. So right now we said we're not developing a form for one test, we're developing a question bank. So how many questions are you targeting? And again, if there are some incentives, you need to plan the budget accordingly. If you have a target, you say the exam is, one form is 100 questions. So you will plan to develop, let's say the launch to have 3 forms. So you'll be writing 300 questions. And then your budget accordingly, if there's any budget for meetings, for compensation, if there is any. Set the quality measures. There was a mention of what are the qualities, what guidelines will we follow with regards to these multiple choice questions? And those quality measures, this is how you'll train your SMEs. And then what's the review cycle of each item? So if this question is written, is their review cycle, will it be a committee discussing it scientifically? What about the editorial review? Will you have editors? What about the cultural review, media review? So what are the steps or the flow that each question written will go through? Then eventually, if it's a new question bank, it's a new exam, there's the standard setting where you're going to have to decide what is the cut score. You have different, and that's totally after the scope of this discussion. What standard setting method will you follow? In some countries, the Ministry of Education or a certain regulatory body has set the pass score at an absolute 50% or 60% or 70%. Or you're going to have to go through a standard setting exercise. Last thing, which is very, very, very important. Please don't forget the political aspect of developing a question bank and involving the stakeholders. Engage the stakeholders throughout the different steps. There's a stakeholder matrix where you could develop and say, if I go through this step, this person is informed, this person needs to approve, this person. Get the buy-in throughout the process so the trust will be built that this has gone through a rigorous process. When the results come out, no one will question the pass percentage or the fail percentage. You've done a rigorous, sound, scientific methodology for this exam bank. And so that time, when the pass rates are not as expected, that will be really a diagnostic tool of what's going on in practice. So I cannot elaborate enough on engagement and involvement of the stakeholders throughout the different processes. So the story of where this idea of bank health index came. Like I said in the beginning, this is the bread and butter of what I do every single day. It's a bit, I don't think there's anywhere in the world where one regulatory body does all of this work. It has its ups and its pros and cons. So currently, the department I oversee, we have around 140 different banks for postgraduate specialties. So that's 140 banks for postgraduate training in all the different health disciplines. And this involves diplomas, 2-year diplomas. It involves residencies, the minimal being family medicine of 3 years and the maximum being cardiac surgery of 7 years. So that's 140 different banks where we have to maintain. Number 2, we have the professional practice or the licensure exams. And that I have around 110 different banks. So for example, someone coming to be restorative dentist, someone coming to be a pharmacist, to be licensed to practice at different levels, we have different exams, written exams, and multiple choice question based. So all in all, we have around 250 different exam banks. And every year, like banks, you know, the inventory in businesses at the end of the year. Last year in December 2021, we looked at our inventory of multiple choice questions. We have exceeded 300,000 multiple choice questions across these different banks. So this is a huge operation of 300,000 multiple choice questions. So, and it's run, the team that I work with is around, today we're around 110 employees, and not all of them are experts in assessment. Most of the team that I work with and that oversee the different banks, their background is strong English. So they have to have a strong English command of the English language, IELTS of 7 and higher, because they're the ones doing the editorial review and ensuring the flow of the quality of the items going into the banks. So now I want them also to ensure that the quality of the bank is maintained. So number one, they help in the establishment of the bank, building the questions with subject matter experts. But now we're at the dilemma of a question bank cannot, it's like a human body. It suffers from diseases. So I cannot maintain all of them. And then everyone coming back to me saying what's going on. And I go into the different signs and symptoms of disease. So the idea came where we need to establish vital signs for a bank that someone who's not specialized, this group here, most of the people are specialized. So, but I'm sure you're working with different team members that are not specialized. And you want them to do this work. You want them to understand how to maintain a bank, especially when you have a large number. I'm sure most of the universities and colleges, if you look at medical school, lots of different subjects, many banks. So the idea came here where I need an index, a bank health index based on vital signs that can say, this bank is sick. Someone is sick in this bank. Someone needs treatment. So this was the idea where it came, where we reached a level where it became hard for specialized people with advanced understanding of assessment to follow up the health and maintain the banks. So the idea came from public health. You know that public health, all of you know, it's a surveillance and monitoring of health determinants, risk, morbidity, and mortality. So when you come to a public, there's some determinants that say this is a healthy population. I took that same concept and put it into question bank health. Think of your 5,000 questions of the medical licensure exam or the physiology subject as a population. So I have 500 questions. They are a population. The health of one accumulates to the health of all. Because when you talk about an exam, all in all, you're delivering 100 questions to a candidate, or 150, or 300 questions. All of these different questions, they contribute their validity, and then they contribute to the score reliability at the end. So you want everyone to be healthy and able to participate in this group. So this is the concept that came up. It's still in the working, by the way, and you'll see where we've gotten. But I really would like to share this because it's a passion project that I'm working on with a team. And hopefully, I think with the brilliant minds, this catches up and we see more and more people talking about it. So think of the bank as a football team or a soccer team. People use football and soccer interrelatedly. So you have these different players. This is, for example, let's say this is a GP or exam. There's items in medicine, surgery, pediatrics, OBGYN, professionalism. So these are the different players. When in a soccer match, you could see someone limping, or someone falls down, or someone sits, or someone cannot continue, and then they say, I need to be changed. So if we think of our items as players in a team, the question here is, what criteria do you suggest? Now you're the coach. What criteria do you suggest to monitor and maintain a healthy question bank? So what criteria for the items do we say this criteria is needed? If we think about human beings, we say you need, right now with the COVID-19, to enter a mall, to enter a school, to enter a university, your temperature needs to be normal. So that's the monitoring of COVID-19 currently in different areas. What criteria do you suggest to monitor and maintain a healthy question bank. So I hope the question is clear. We'll go back into the small groups, and what do you suggest? Just list 1, 2, 3, 4 to be the criteria to monitor the health of a question bank based on the individual players that you have. You have lots of players playing. How will you monitor their health? What are the vital signs that you recommend to monitor the health of this bank that has 500 different questions? So I'll assign you to small groups. We'll take this exercise, will take 10 minutes, and please, we'll take 2 or 3 different people to present what was discussed in the group. See you in 10 minutes. Well, welcome back, everyone. I think we have the rooms are closing. Again, it'd be really, really nice to see people. So please, if you could turn on your camera for this discussion and you could see everyone. This is an amazing international, diverse group, very experienced. So we'll probably have 2 or 3. Amar.
Yes.
Please, you start.
Okay. Actually, we were in group room 1, and so I will just briefly discuss what we have discussed. Like the general physical examination, we do few things. So the overall first thing is, when we look at the patient, the first thing what you will see is, when you look at the patient, you have a face validity. So first thing we discussed that the question bank should have a face validity, which can be determined by the experienced educators. The second thing we discussed, the pulse rate. Like we just measure the pulse rate, means heart is working or not. This is the discriminatory index, which can discriminate that is our question bank still discriminating between good, average, and poor. And respiratory rate, actually the difficulty index, that how much his lungs are working in the area, in the even era of COVID. And the temperature, we have taken fairness according to this, that is our exam fair enough to take high stake decisions in the end. And in total, the GCS, the Glasgow Coma Scale, that how much alert our bank is, we will take the validity as total. So we have given you all 4.
I love it. Amazing. Thank you very much for the group 1.
You're welcome.
So can you please share with us your group discussion?
Okay, happy to be with among you all. We were in break room 6, and the vital signs for a healthy question bank we agreed upon are like the number of questions. They are a good number and continuously increasing. The functionability of the questions, they are all functioning and they are all in good quality, and that depends, of course, on the analysis of the system of the question bank. The feedback, whether it's quantitative from the analysis or all the indices, the difficulty index and the discrimination and point by serial, and also the qualitative feedback from the students and the faculty working on the bank. Also the reviews, either internal reviewers or external reviewers with samplings from a number of disciplines to check the quality of the bank. And we were talking about, okay, when are we going to do this check? So we agreed upon having a surveillance system with like criteria from the beginning. So after each exam, or annually or biannually, and this is set from the beginning so that we have this check going on and on.
Thank you very much. I have Miss Siva. She's saying you have to wrap up for the Q&A. So I'm very sorry for those raising their hands, but we'll have a Q&A and opportunity for comments. Very, very rich discussion. I was thinking an hour and a half, oh my goodness, what am I gonna do? But with this really engaging, experienced group, I think we could go on for 3 hours and learn a lot from each other. So please, if you excuse me, just to wrap up, and then I'll leave more time for the comments and this brilliant collective experience of everyone to be shared. So when we thought of the Bank Health Index, I thought I have more than currently the editors overseeing the banks. They're around, I have the operations, so they're around, let's say 50 people who oversee these different titles. We said that we have 250 banks, around 50 people. So that's an average of everyone overseeing around 50 different titles. How are they going to maintain the health? How are they going to monitor what's going on? So, and they're not experienced. Their background mostly is in English, as I mentioned before. Very good command of English language. They understand how to develop items. They understand the process, they understand the flow, they understand the blueprint, subject matter expert training. Now how to maintain the bank. So this was the idea. We needed to have an index that is user-friendly. My friend Umar, he really touched on it. He said pulse, respiratory temperature, the Glasgow Coma Scale even, and he gave the different parameters, item parameters or fit measures. So the goal was to help a non-specialized staff member that is not like this group and they're academics and they have extensive experience in assessment to monitor and take action when needed, because this bank is sick, or there are some individuals that are sick that are affecting the overall public population health. So number one, there was a mention of the quality of the questions going in, and I can't emphasize on this enough. So this is one of our team members. We started with teaming up. The gold standard, we all have to admit in writing multiple choice questions, is from the MBME. They're the ones who, the organization that oversees the USMLE. This document, you could find it online, it's for free. It has all the research and guidelines on how to write multiple choice questions. It tells you why you should not use none of the above. Why you should not use all of the above. What are the guidelines with regards to the STEM and Vignette? What's the guideline with regards to the leading question, the options? So please refer to this. So what we did with our faculty, like I told you, they will monitor the health. We had our faculty go and train with the faculty or with the staff from MBME. So they went to Philadelphia, Pennsylvania. That's the headquarters where MBME is. Market Street, 3750. You could check it out on Google. They went and they trained with them side by side, and they understood what a question should be and how it should be constructed, what are the flaws. So that's number one. And they are the gatekeepers for any question coming into a bank. Now the questions are actively participating in matches. Like we said, if there was a football team, there's 500 questions, you choose 100 players, they go and they play a match, or they participate in a test. And then these questions, they come back and join the population. So initially they're all healthy, someone goes and plays and they come back. So I need something to monitor their health and how they're performing. If anyone has been injured while playing. So again, if we go to the same question of field players, these are the different items. There's item 3, covering section 3, domain 11. So these are the different items and different players here in the team. The one thing you could notice is each and every team needs to have some substitutes. It needs a substitute. The problem, the first thing with the health of a bank is there are substitutes. If this item or this player is injured, imagine a team that only has the main players. There's no substitutes. A player gets injured and the team plays with one less member. Or they're going to have to let this player play while he or she is injured. So if you could see here, for example, number one thing you need to find is how many questions, healthy questions do I have that could replace an unhealthy question? If you look over here, item 5 or section 5 does not have any substitute players. And this is a major problem. This will affect the index if item 5 is injured or is unhealthy. So number one thing, please, when you look at your question bank, there was a mention of the different components or parameters of an item. The number one thing is, are there any gaps in your exam? If you have a blueprint and you have a certain number of questions, just ensure that there are questions that are being retired, there are questions that are not used anymore, there are questions that are outdated. Especially if you have frequent deliveries, ensure that you have good substitutes, because any gap in one of the sections, it can affect the performance and you'll be using injured or sick items because you don't have a substitute. So one of the planning aspects is how many questions do I have within a form and how many substitute questions could be part of this bank. Number two, there was a mention of the difficulty discrimination distractor. I'll not go over them, but also these are some of the indicators that can be used. Difficulty, everyone knows difficulty. Basically, I tried to keep it simple. There are some you could go with item response theory, you could go with rash, general liability theory, but we tried to keep it with classical test theory. Again, we're talking about giving a tool to non-experts to be able to monitor the health of a question bank. So use basic difficulty. Number of correct responses over the total number of responses. That's basically difficulty. And I do not know why it's called difficulty index until today. It should be called easiness index because the higher it is, the easier the question. But oh well, it's difficulty. The higher it is, the easier the question. If a difficulty index was 0.85, it means that 85% answered it correctly. The lower the value, the more difficult the item is. So set a guideline of what you would categorize as difficult, what you'd categorize as moderate, what you'd categorize as easy. This is the guideline we use, or we're using for this item health index. A difficult is less than 20% or 20 to less answered it correctly, and easy would be, and you could have more elaborate categorization if you would like. Discrimination, basically discrimination, you want to know who is studying and you want to compare them with the people who are not studying or the group who are not studying. So you want to know you're comparing the top scores with the bottom scores and their performance on each individual item. So let's say over here, we have 400 students taking the test. We took the top 100 scores and we took the bottom 100 scores and we see how they performed in each individual item. And this is the discrimination index. You do not need to know the equation because a standard Excel sheet, it can calculate the discrimination. All you need to know is to have the team understand what does it mean and how it's calculated. The last thing is the distractors, and looking at the distractors, basically distractor analysis is if you have 4 options, if you have 5 options, what's the percentage of people that chose the correct answer, and what's the percentage of test takers that chose the different distractors. So I'll probably go through this exercise very fast, and we could utilize the chat if possible. Over here, when you look at this specific question, so in the coming questions, which question would you like to review and why? So if I look at this analysis, what is the question? And please, you could write it down on the side, on the chat. What question do you think should be reviewed? If you had only one question to review, what number would it be? So you have from 86 until 93. So see what says 80, 93, 88. Oh, this is, I see 88, 87, 88, 93, 88. Oh, 88 is a good competitor. 88, I see it between 88 and 93. Dr. Salah, 88, 89, and 93. So there's a lot of 88 and a lot of 93. So I could see where the hawks and doves here are. So probably the hawks are saying 88 has been answered by 91% of the group. The top group, 92% answered it, and the bottom group, 94% answered it. So more or less they're equal, almost. And it has one, and D is a non-functional distractor. No one chose it. But the doves who really feel for their students and something is wrong, they looked at question 93. 93, only 22% answered the question correctly. More or less the top and the bottom group got it correct, but the upper being more, which gives it a positive point by serial or discrimination index. But you look at the options, at the distractor analysis. So the key answer was chosen by 28 test takers. C was chosen by 95, and A and D are non-functional distractors. So something is going on over here. Is there a gap in knowledge? Is this a miskeyed item? Is there not enough information to choose the key answer? So if I was to choose, again, I totally agree with the group, it would be between 93 and 88. So the bank health index, just to wrap up, the bank health index, we currently have all these different parameters where we've put together the bank gaps, item exposure, difficulty, discrimination, difficulty drift, and rash-based infant statistics, where all these together, they build something called a BHI, Bank Health Index. So for the different 250 titles, the team member has, or one staff member has a dashboard which has internal medicine, 91, general surgery, 52. So that index, the goal of each team member is to maintain the index at above 95%. When the players go and play and they come back with injuries or a change in one of these parameters, the index either goes down or goes up. And accordingly, the team member has to do a deep dive and look who here is sick. This is initially, we're experimenting with these different parameters, and each parameter will give a certain score. And this is collectively, it will flow into that index that you see. This is still work in progress. I think as soon as we get this right, we will publish all these different parameters. I really wish that this catches up with universities and colleges, and you have a very simple bank health index to be able to monitor the health of this very dear population that you have. Thank you very much. I really appreciate everyone's time, and back to Ms. Siva.
Thank you, Dr. Munshi, for this amazing presentation. We couldn't have enough time to really discuss a lot, but there's a lot to discuss. But I just wanted to ask a few of the questions given by our participants. So like, do we have any time frame to update our health bank index? How often should we update it?
I really rely on the banks. I rely on this as being the flag that tells us something is wrong. Go into a deep dive. These are flagged items. Go into the flagged items and look at them. So this is a continuous cycle of every time the items are used, the performance changes, and look at this question. And this is where the drift came into play. When an item difficulty drifts, it could be due to multiple factors. It could be because this item is, let's say 70% used to answer it correctly. Now only 20% are getting it correctly. It could be a gap in this cohort's knowledge, or it could be that this item is outdated. This information, the key answer is outdated, so people are getting it incorrectly, but I haven't updated that item in the bank.
Dr. Munshi, before we begin with Dr. Professor Hussam is with me. He wants to give a personal message to you. So over to Dr. Hussam.
Assalamu alaikum, Professor Munshi.
Ahlan, sahlan, ahlan,
Ahlan. I have been trying to call you several times. It's very difficult to find you.
I'm sorry.
Well, I really want to thank you. And I'm very sorry that we are not together here in Dubai, but I'm waiting for you at your convenience to be with us anytime, which is convenient to you. It would be great to have you with us here.
Thank you. That's it. It would be an honor.
I have enjoyed listening to your presentation and the amazing workshop, and I love the diseases of the question bank, which reminds me of the diseases of the curriculum, which was published many years ago. And but it's a fantastic approach of how to treat these sick patients and the anatomy and physiology and pathology of the bank. And I think this is amazing. I'm sure more than or close to 200, I think they are attending this workshop. And now with your presentation tomorrow, more than 3,000 have been registered in this workshop, in this conference. So you will be known in more than 35 countries, from China to the States to South Africa to everywhere. Well, alhamdulillah, and I really appreciate that, and I appreciate accepting our invitation. But this is just the beginning, and we'll continue working together, inshallah. I have special greetings from one of your close friends. I was with him a couple of weeks ago, Ahmed Ansari, in Bahrain, and Ahmed is very close to me, and we are here. And when he knew that you'll be presenting today, he was very excited and happy, and looking forward that the three of us can meet together, inshallah. So thank you very much, Dr. Fadi, and I can leave you after that with many questions I think the participants would like to ask you. So thank you again.
Thank you, Professor. Thank you very much. Really appreciate it.
Thank you, Professor Hamdi, for your kind words. Thank you. So let's get on to the chat and see if we have any questions from our participants.
Let me see if we have, there's lots of experts here. If we could get comments. I see Dr. Salah.
I'm looking for the comments and questions if there are any.
Absolutely.
Okay, so before I just have one question, Dr. Fadi Munshi. You were saying like we should have some gatekeepers before the questions get into the bank, right? How do we decide on these gatekeepers?
Yeah, the gatekeepers, we invested a lot. So I have around 45 staff members who are the gatekeepers. They're the ones who work with different subject matter experts to develop the content. But they have a key role when it comes to editorial, because a subject matter expert may be an expert in their field, but the flaws, the best practices of writing multiple choice questions, they need to be well trained in it. You do train your SMEs, but the SMEs, this is not their everyday bread and butter. They're doing surgery, they're seeing patients. And you don't expect them to be able to catch on these different flaws and best practices. And that's where you have your internal team well-trained, language-wise, best practices, and have a sense. If something doesn't seem right, check with an subject matter expert.
Thank you. Can we use KR20 as indicator for healthiness of the exam content?
Yeah, you know, KR20 is a reliability index, and usually the reliability, the way I see it, maybe some of the experts here can comment. The way I see it, it's the reliability of the test scores. So it's really an attribute of the score. In talking with different psychometricians, it's more or less an attribute of the test score, not an attribute of the actual quality of the question banks. So because KR20, if sometimes one of the things you could do is increase the number of questions within a form, and you could increase the reliability of the test scores of that cohort on this specific test. So it couldn't be linked directly towards the quality of the question bank. It's more towards the reliability of the test scores. So it's an attribute of a test score, not an attribute of the actual question bank and quality of the items.
Okay, thank you, Doctor. And we will take this as a last question from Dr. Umar Farouk again. Sometime improving the difficulty index leads to reduced quality, like lesser information. How to handle this?
Reducing the difficulty, excuse me?
Yeah, sometimes improving the difficulty index leads to reduced quality, like less information. How to handle the situation?
Improving the difficulty index leads to reduced quality, like lesser information. I'm not sure I get what improving the difficulty index. I think there's one thing sometimes we mix is the complexity of the item with the difficulty of the item. So we control, as subject matter experts, as people who write, authors, we control the complexity. So we could say this is complex and it's being a knowledge recall fact, or being something that has more higher level thinking, problem solving, analytical thinking. But the difficulty is usually in the field. So after this item is being tested, actually, that's where we get the difficulty index that tells us this is difficult, moderate, easy. So difficulty is an attribute of the test takers and when they take the test. But probably when we increase the complexity or decrease the complexity, I think that would be the question, where the complexity really should be based on the test takers and what objective are you measuring? The question is usually based on objective. If this question serves this objective, serves the level of these trainees, well, then the difficulty could be related to other things other than the quality of the question.
Thank you. So we have our own Professor Salah, who is waiting to ask you some questions. Yes.
I've been waiting for him to comment, not ask questions.
Thank you very much, Professor Fadi. An excellent workshop. Really, it was an eye-opening, and I think the analogy of the bank health index is something that is innovative, and it was very interesting. I enjoyed very much the workshop. I agree with you that I think before looking at numbers for evaluating the health of the questions, I think we should go back to some criteria. One important aspect is going to the content expert and make sure that there is no problem with the content of the question. Sometimes we have terrible psychometrics of the question, and then we check with the content expert, and simply, sometimes the option may be misplaced. So B instead of C, and then everything will change. Also, the number of participants or the examinees, and also the number of test items. So all these should be taken into consideration. I think making a decision based on just numbers, I think that I think it will alert us, but I think making the decision will be based mainly on going with the content expert, and of course the process expert who will look at any technical flaws in the design of the question. I have a question for you about from your experience, about the copyrights of the questions and the authorship. Sometimes we have questions, and if you have a big bank like the one that you have, and sometimes you see questions which are modified by some authors, and then depends on the degree of modification that's happening. How do you deal with that and to maintain the authorship and the copyrights?
Yeah, Professor, thank you very much for your comment. I totally agree. This psychometric flag is only a flag. That does not mean this question is wrong or inappropriate. It's just a flag to take it to a content expert to give it his or her opinion. So I totally agree with that. Don't take psychometric analysis or these item parameters for granted. Authorship and copyright and security of the items, that's a major issue. With the items we have, you see them sometimes on social media. Students everywhere in the world, as soon as the exam is done, they have groups where they go and they write the items and they gather and collect as much as possible. You can never prevent it. The one thing is we have very strict legal consequences if you are found saying that these are questions from this entity. And I've looked at practice in different countries. I think Egypt has more strict rules than us. That if you expose a question from a university or an organization, there's jail time you need to serve. And I've seen that law. I think it's just like a security in a airport. You need to have as many laws to try to prevent it, but it will happen. When it happens, if you catch someone by name and they say, and we've had a few people, you have to take it to the extreme of persecuting them and taking them legally to court. We've done this and it scared some people. Probably they're doing it hiding and doing it not with their names. But the thing is, what we do is we try to monitor the performance of the items using the drift. So you have item difficulty drift, you have the item discrimination drift. You could only do so much. You need to do lots of different measures. Look at your items, how they're performing. Have they changed? Have they drifted or not in their performance? You need to have monitoring of, currently we've teamed up, I don't know if I'm allowed to say, one of the probably the most recognized company in test security. We've teamed up with them and they have different monitoring tools for social media and internet to track items if they've been exposed. And then put all your legal consequences and make sure you communicate with test takers. And you can never stop it. Wallahi, Professor Salah, I'm sure you know, you can't stop it. Because we've been students before and we've seen, it's still going on. Steve, if you allow, please, Professor Zayat, just a comment. He's my teacher. He's my mentor.
It's a very small question, but taking you in another direction. Assuming that we are having a huge question bank, can we allow the students to access it?
We've tried this once. I've seen this more, it's done in the formative assessments. It's more done in when you're assessing for learning. When you give them here, these are 5,000 questions. Your test will be from 100 questions from this sample. And you could say from these 5,000, if they know how to answer and they understand these 5,000, yeah, they're good. They're good to go.
Yeah, this is what I mean. Yeah.
I think if the goal, if the purpose, again, the first mention over here, one of the groups said, is the purpose is formative learning, for learning, to encourage feet, why not? But if you have that luxury of developing 5,000 questions for learning and for formative assessment, I congratulate you. I commend you for that. we're ready to develop it for the summative high stakes licensure exams. But I think assessment is a major, very, very underutilized tool for learning. And we need to move more and more to the direction of utilizing it more for learning and not the assessment of learning.
Yeah.
Thank you very much, Professor, and it's really good to see you.
Thank you. I'm happy to see you also. Yeah. It's long time since we met.
يعطيك الصحة والعافية يا رب.
Allah يخليك.
I'm sorry you exceeded our time for 10 minutes, but back to you.
Yeah, and it is time for Gumma praying now.
Thank you, Dr. El-Sayed. Thank you, Professor Sala. And thank you all the participants for joining in. And I'm sure like most of the questions we couldn't discuss, but please shoot your questions. We will get in touch with Dr. Fadi, like if you could answer our questions later on, if it is possible. Thank you. Thank you all. And thank you, Dr. Fadi. Thank you so much for your participation. Thank you so much. My pleasure working with you. Thank you.
Bye-bye.
Bye.